Hello and welcome. Today we're diving into a condition affecting the esophagus called eosinophilic esophagitis, or E. We'll explore what it is, what causes it, how it's diagnosed, and what can be done to manage it. So, let's get started on understanding this increasingly common digestive disorder. Eosinophilic esophagitis, or E, is primarily triggered by an allergic reaction. While the exact causes are still being researched, the most common culprit is food allergens. These allergens prompt the immune system to overact in the esophagus. Inhaled environmental allergens, such as pollen or dust mites, can also contribute, although less frequently. Genetic factors may also play a role, making some individuals more susceptible to developing E. It's a complex interplay of environmental and genetic influences that ultimately lead to this condition. Now, let's talk about what's happening in the esophagus with E. The allergic reaction we mentioned triggers an inflammation process. This inflammation specifically involves eosinophils, a type of white blood cell that normally helps fight parasitic infections. In E, these eosinophils migrate in large numbers to the esophageal lining. Their presence causes damage, leading to swelling, irritation, and the formation of scar tissue. Over time, this can narrow the esophagus, making it difficult to swallow and even causing food to become stuck. E is considered a relatively new disease, and its prevalence seems to be on the rise. While it can affect people of all ages, it's more commonly diagnosed in children and young adults. It also tends to be more prevalent in males than females. The exact reasons for its increasing occurrence aren't fully understood, but it's likely related to changes in our environment and dietary habits. So, how does eosinophilic esophagitis manifest? The symptoms can vary depending on age. In infants and young children, you might see feeding difficulties, vomiting, and failure to thrive. Older children and adults often experience dysphagia, or difficulty swallowing, and food impaction, where food gets stuck in the esophagus. Chest pain, heartburn, and abdominal pain are also common complaints. Importantly, these symptoms can significantly impact quality of life. Diagnosing E requires a comprehensive approach. The key is an upper endoscopy, where a thin, flexible tube with a camera is inserted into the esophagus. During this procedure, the doctor will look for visual signs of E, such as rings or furrows in the esophageal lining. More importantly, biopsies are taken. These tissue samples are then examined under a microscope to count the number of eosinophils present. A diagnosis of E is usually confirmed when there are 15 or more eosinophils per high power field in the biopsy sample, in addition to the presence of esophageal symptoms. While E isn't strictly classified into distinct types, it's important to consider the presence or absence of other allergic conditions. Some individuals with E may also have other atopic diseases, like asthma, eczema, or allergic rhinitis. These coexisting conditions can influence the overall management approach. The primary goal of treatment is to reduce inflammation in the esophagus and relieve symptoms. This is typically achieved through dietary modifications, medications, or a combination of both. Dietary therapy often involves an elimination diet, where common allergenic foods are removed from the diet and then reintroduced one at a time to identify the specific triggers. Medications, such as topical corticosteroids, are used to reduce inflammation directly in the esophagus. In cases of severe esophageal narrowing, dilation may be necessary. This involves gently stretching the esophagus using a special balloon or instrument during an endoscopy. While completely preventing E may not be possible, there are steps individuals can take to minimize their risk and manage the condition effectively. For those with known food allergies, strict avoidance of those allergens is crucial. Breastfeeding infants for as long as possible might have a protective effect. Avoiding exposure to environmental allergens, such as pollen and dust mites, may also be beneficial, especially for individuals with allergic sensitivities. Regular monitoring and follow-up with a healthcare professional are essential for long-term management. The prognosis for individuals with E is generally good with proper management. While E is a chronic condition, symptoms can often be effectively controlled with dietary and medical therapies. Recent research has focused on identifying specific biomarkers that can help predict treatment response and guide personalized therapy. New biologic therapies that target the immune pathways involved in E are also being developed, offering promising potential for future treatments. The continued research into the underlying causes and mechanisms of E is paving the way for more effective and targeted therapies, improving the quality of life for those living with this condition.